It's important to realize that pregnancy really should be seen as a window of opportunity. Over 30% of patients are engaged in treatment for the very first time during pregnancy. So pregnancy is really a time to engage patients in necessary services such as treatment, counseling, behavioral therapy, and social services support. So the onus is really on OBGYN providers to identify patients who may struggle with dependence and addiction, to engage them in treatment, to refer them to a treatment provider, and to provide all of the resources that we have available to really facilitate their long-term recovery beyond pregnancy and for their future. It's very important for OBGYNs to identify and screen patients at their first OB visit for both drug and alcohol use. When I say screen, it's very important to screen with a conversation. Patients will respond to a non-judgmental approach by providers. They will respond when providers really want to engage them in what has been happening to them prior to pregnancy. So to identify through conversation drug and alcohol abuse that may be occurring is extremely important for OBGYN providers. There are multiple areas of research where we can really improve patient outcomes. The first area is trying to determine which treatments are best for which patients in pregnancy. We have a lot of treatments available, including medications, counseling and behavioral therapy, and social services support. And determining which of these treatments is right for which patients is an important research question to answer. In addition to identifying the right treatments for mom, trying to identify the right treatments for baby after delivery is also a very important research question. We have a lot of treatments available for something called neonatal abstinence syndrome, or NAS, which is a drug withdrawal syndrome that happens with babies after delivery. So determining which treatments we have available are best for which babies to treat NAS is a very important research question that also needs to be answered. In addition to finding the optimal treatments for mom and baby, we also need better research on the long-term outcomes of these babies after delivery. We have a lot of information on treatment in the neonatal period, but we need more information on how these babies do into school age and into adolescence.